Have you ever experienced dizziness triggered by loud noises, or felt like your own voice is echoing inside your head? It might be more than just a passing discomfort. Today we're diving deep into a fascinating and often misunderstood condition called superior semicircular canal dehiscence, or SSCD. We'll explore what causes it, how it affects you, and what can be done about it. So, buckle up as we unravel the mysteries of this unique inner ear disorder. The exact cause of SSCD isn't always clear, but it boils down to a thinning or complete absence of the bone overlying the superior semicircular canal, one of the balance sensors in your inner ear. In many cases, it's believed to be a congenital condition, meaning individuals are born with a predisposition for this thinning. However, it can also develop later in life due to trauma, infection, or even normal bone remodeling processes. Think of it as a weak spot in the skull that, over time, becomes vulnerable to this dehiscence, or opening. So, how does this little hole cause so much trouble? The superior semicircular canal normally responds to head movements. When the bone above it is missing, it creates what's essentially a third window into the inner ear, the other two being the oval and round windows. This abnormal opening allows sound and pressure to inappropriately stimulate the balance organs. This leads to the disorienting symptoms characteristic of SCD. Sounds that normally wouldn't affect your balance suddenly do, and the normal fluid dynamics within the inner ear get disrupted, throwing off your sense of equilibrium. SSCD is considered a relatively rare condition. While the exact prevalence is difficult to determine, estimates suggest it affects a small percentage of the population. It's important to remember that many people with a dehiscence may never experience symptoms, making it even harder to pinpoint the true number. It affects both men and women relatively equally, and is often diagnosed in middle adulthood, although symptoms can manifest at any age. The symptoms of SCD are diverse and can significantly impact quality of life. One of the hallmark symptoms is sound-induced vertigo, also known as Tullio phenomenon. This means loud noises, even everyday sounds like music or traffic, can trigger brief episodes of dizziness or imbalance. Another common symptom is autophony, where your own voice or internal body sounds, like your heartbeat or eye movements, sound unusually loud and clear in your ear. Some individuals may also experience chronic dizziness, pressure in the ear, hearing loss, or even a sensitivity to vibrations. Because these symptoms can mimic other conditions, accurate diagnosis is crucial. Diagnosing SSCD involves a combination of a thorough medical history, physical examination, and specialized audiological and vestibular testing. A key diagnostic tool is the VMP test, or vestibular evoked myogenic potential, which measures muscle responses to sound stimulation. Individuals with SSCD often show abnormally large VMP responses. A high-resolution CT scan of the temporal bone is also crucial to visualize the dehiscence itself. This scan helps to confirm the diagnosis and rule out other potential causes of the symptoms. While there aren't specific types of SSCD in terms of fundamentally different conditions, the severity and location of the dehiscence, as well as individual sensitivity, can result in a wide spectrum of symptom presentation. Some individuals may experience mild, infrequent dizziness, while others are severely disabled by constant vertigo and debilitating autophony. The size and precise location of the bony defect can influence the specific symptoms a person experiences. Treatment for SCD depends on the severity of symptoms. For mild cases, conservative management, such as avoiding triggers like loud noises, may be sufficient. When symptoms are more severe and significantly impact daily life, surgical intervention may be considered. There are two main surgical approaches: plugging and resurfacing. Plugging involves blocking the affected semicircular canal with bone chips or other materials. Resurfacing involves repairing the bony defect with bone cement or other biocompatible materials. The goal of surgery is to eliminate the abnormal third window, affect and restore normal inner ear function. The choice between plugging and resurfacing depends on various factors, including the size and location of the dehiscence and the surgeon's expertise. Unfortunately, there are no proven methods to completely prevent the development of SSCD, especially when it has a congenital basis. However, protecting your head from trauma and promptly addressing any inner ear infections may potentially reduce the risk of acquired SSCD. Since the condition is not fully understood, further research is needed to develop preventative measures. The prognosis for individuals with SSCD varies, depending on the severity of their symptoms and the chosen treatment approach. Many people experience significant relief from their symptoms following successful surgical intervention. However, as with any surgery, there are potential risks and complications, including hearing loss, imbalance, or continued dizziness. Research is ongoing to refine surgical techniques and improve outcomes. Scientists are also exploring non-surgical treatment options, such as vestibular rehabilitation therapy, to help individuals manage their symptoms and improve their balance. The future holds promise for even more effective and less invasive treatments for this intriguing inner ear disorder.